Hello and welcome to our first in two videos about our Ascension Stevenson program here in Indianapolis. To learn a little bit more about our program. My name is Sam Lozier. I am Residency Program Director here at Ascension Stevenson, and I'm so excited to share some information with you today. I would like to start with a reflection. I think this is something pretty unique to our organization that we start most meetings with a reflection, sort of ground ourselves on why we're here, what our goals are. So today I wanted to share a quote from the Daughters of Charity, which were the nuns who founded Ascension many, many years ago. And they said, "We have a mission, a reason for being here, to keep healthcare human. Human for our patients, human for our families, human for our doctors, and human for all associates. The poor will come and the rich will come if they know they are going to be treated as people." I think the values that they built Ascension on all those years ago really do hold true, especially maybe within our program. But I like to think that the organization as a whole carries that forward as well. A little bit about me. My name again is Samantha Lozier. I am a Hoosier from Indiana, born and raised, and was lucky enough to go to IU School of Medicine for my medical school training, and then come here to Ascension for my internal medicine residency. I was lucky enough to serve as one of the PG-by-3 chief residents, where I sort of fell in love with academic medicine. I have been the program director since April of 2024, but have been a part of the program ever since I graduated from residency as a core faculty and then as an associate program director since 2021. I am a wife and a mom, and some things that I love are the mentoring and educating pieces of my job, as well as humor and sarcasm. A little bit about the rest of my leadership team. So these are our associate program directors. Dr. Whitney Fraze is one of our inpatient APD leads, and also did her training at IU and then came here for residency just after I did. So we were residents together for a time. Dr. Jennifer Mundell is our new transitional year program director. She did medical school at Louisville and then came here to Ascension for her training. Dr. Naus is our ambulatory APD lead and also our primary care track lead. He went to school also at IU School of Medicine and did residency here at Ascension. And then Dr. Spencer Romstad is new to our APD team this year. He did his medical school at Medical Universities of Americas and then did his residency training at the Advocate Lutheran General Hospital in Illinois, and now it's here as an inpatient attending with us. Some other members of our team include Assistant Program Director Emily Copert, who is also the Medical Director for our Pulmonary and Critical Care team, and the Fellowship Director for the Pulmonary Critical Care Fellowship here on campus. Dr. BJ Fick is our Internal Medicine Clinic Director for our residency clinic, and also serves as an Assistant Program Director, as well as the Student Liaison for students who rotate in our clinic. Additionally, some core faculty, Dr. Megan Mobley, who did residency here, and it's now a hybrid, so does part-time outpatient medicine, part-time inpatient medicine. She has a niche with substance use disorder and runs an outpatient substance use disorder clinic here from our primary care clinic. Dr. Allie Palmer, who also graduated from our residency program a few years ago, who splits her time between inpatient medicine and LTAC medicine at a facility nearby called Seedco. And then Dr. Jay Nast, who is a nocturnist on campus, has been, I think, over 10 years a nocturnist here, did his residency at Duke. So excited to have these three as eager and excited core faculty members for the year. The real MVPs of our program, probably most programs, is our coordinators. Our coordinators include Hannah Ramirez and Erica Paulos. They are the internal medicine coordinator team. Erica splits her time between the internal medicine residency and the cardiology fellowship, but you'd never know that. She pays so much attention to us and does everything we need so well. And then Katie Wenzel is the TY program coordinator, and the three of them work really closely together since our two programs are pretty intertwined. Our chief residents this year include Dr. Michaela Castleman, Dr. Annie Georges, and Dr. Victoria Jasek. Dr. Castleman did her training at UConn and then is our ICU chief lead. She is interested in going into pulmonary critical care medicine, and so she sort of spearheads and is the go-to person for all ICU needs in her chief role. Emmy Georges is our primary care clinic lead. She's actually in the primary care track and plans to go into primary care medicine after graduation. And then Victoria is our inpatient medicine lead, sort of the go-to for all internal medicine ward questions. She is going into rheumatology fellowship after this year. So I'm so grateful for these ladies and the leadership they're providing. A little bit about our organization. So Ascension Health is a not-for-profit healthcare system that has locations across the country. We are the largest Catholic-based healthcare organization in the U.S. and actually one of the top 5 GME organizations as well, meaning Ascension as a whole supports many, many GME programs throughout the country. We are one of many internal medicine Ascension programs also exist in Wisconsin and even in Southern Indiana. Ascension was founded by the Daughters of Charity on core values, and the core values that are still on the back of all of our badges and highlighted across the organization include service of the poor, reverence, integrity, wisdom, creativity, and dedication. As I said, I really do think that these values are a key and a core part of training. A little bit about who we are as a program. We are excellent physician professionals and leaders. We're people of integrity. We model empathy, respect, and compassion for patients and colleagues. We have a culture of curiosity, feedback, accountability, self-reflection, and continuous evolution. We are creative and innovative. We strive for equity and transparency. We embody positivity, honesty, and teamwork. We are forward-thinking, anticipatory, and visionary in determining how medical education is influenced by societal and healthcare pressures and trends. A key example of that might be AI. We understand what is best for our patients is also what is best for our learners. We seek a diverse team of physicians, both faculty and residents, who represent our community. We provide high-quality, evidence-based care and are committed to lifelong learning. We promote high-value education and strive for real-time, resident-driven change. We are values-centered, mission-driven residency program serving current and future needs of our community. And lastly, we believe a supportive learning environment and a strong mentorship environment are critical to professional and personal success. Our mission, as I said, is to provide exceptional training environment with an emphasis on high-value education. We also, I think, really strive to walk the line between academic rigor and knowledge with well-being. We also seek to be values-based and innovative in our program with ongoing evolution to meet the needs of our learners and the needs of our community. A broad goal is to be the best community-based IM program in the country. We want to continue to recruit excellent residents into our program. That is the best way that we get excellence is by finding excellent people and having them join us. To create a culture of curiosity and high self-expectations, high self-awareness that will fuel the desire for self-improvement throughout your career. We want to recruit excellent faculty with an interest and skill in medical education. We want to hold each other accountable for our educational mission and have a diverse group of residents and faculty, again, who represent the community that we serve. Our residency motto is hard is the good, let's embrace the challenge together. When you graduate from our program, as these fine folks did in 2025, our goal is that you are the professional physician that you've always aimed to be. One thing that I think our program does really well is to provide the foundational education and experience that you need to become an excellent general medicine internist, whether that's outpatient or inpatient focused, or going into fellowship. We want to provide that supportive environment, that rigorous academics, the mentorship, the coaching, and the well-being support that you need to get there. So some good stuff about us, what makes us us. A little bit about our medical knowledge. Our residents get program access to MICSAP and ACP board prep curriculum. And new this past year, we also provided AMBA subscriptions for all of our residents. That will continue. I like that you can use this in your intern PGY1 year to study for level 3 or step 3, and of course throughout the time in residency to study for IM boards. We also provide and pay for the ITE or in-training exam each year for all levels of training. This is usually taken in the late summer, and then scores come back in the fall. For anyone who doesn't score as well as they want, especially as you become a senior, we have a remediation plan and with faculty oversight to help bulk up your test taking or medical knowledge. Some highlights about us, I think, really reflected in our goals is our innovation and the goal that we have for continuous evolution, primarily built on resident feedback. Our didactics, which were implemented a couple of years ago, have really taken off. We do didactics every Wednesday afternoon, and it alternates week to week. So the first and the third week of each month is our PGY1 and student didactics, and then the second and fourth Wednesday is our senior didactics. That way, the education and goals of the speaker can really be tailored to the audience members. In addition, every noon hour over the week, we have some learning. So on Wednesdays from noon to 1, we have all resident conferences. This includes things like M&Ms, journal clubs, grand rounds. And then on Mondays, Tuesdays, Thursdays, and Fridays from 12:30 to 1, we have what we call Clinical Reasoning Conference. Colloquially, this is also called Morning Report, but we do it at noon. So residents can come down and take a 30-minute break from their clinical time to eat lunch and to learn from each other. This often will be a resident or a faculty presenting a case and walking through the clinical reasoning of that case. Some other highlights, I think a big one for me is teaching. Both as a resident and now, teaching is one of the best ways to learn, and you will get to teach when you rotate with us as a resident. We are affiliated with IU School of Medicine and have learners on inpatient wards most months from them, as well as the home program for the Marian University College of Osteopathic Medicine. And so we have students from that medical school across most campus, and you will get to teach and learn them. DEI is still here. I know the national scope is moved away from that a little bit, but I am so grateful that our local leadership still prioritizes that and understands the need for DEI for each of those things individually and together. We have a GNE subcommittee that focuses on cultural awareness. They hold things like cultural potlucks, which are really fun. And also provide GNE Grand Rounds quarterly with sort of an emphasis on DEI. Whether or not we call it that, it's still there. We also are partnered with SMA for guiding and mentoring students who might be underserved or underrepresented in medicine. And then we do highlights within the program, things like the LGBTQ curriculum to help residents learn how to care for these underserved patients. We aim to be a culture of feedback, and within our program, we need feedback to grow, and so do our learners. And so it is bi-directional. We are constantly asking for feedback from residents about their experiences and rotations. And then likewise, are eager to provide feedback to you as the learner, both through daily observations, whether that's from your seniors and attendings, or the end of week and implementation summative feedback that you get through new innovations. Something that we really aim to do is ask you to set your own goals, to tell us what goals you want to reach, and to really practice that growth mindset of being a lifelong learner and constantly aiming to improve yourself and your skills over time. We have a pretty robust wellness committee, both within our program and across campus. Some fun things they do are things like the fitness and step challenges, monthly book clubs, monthly third Thursdays, where residents get together at a local restaurant and have food and drinks together. We do fun things like photo contests. And I think this month it's the football, I don't know what it is, like the football thing where you pick the team that are going to win. I don't know. I'm not very good at that. Some more serious things that the Wellness Committee does and participates in are what we call safe zones, as well as the pathway to report. and our annual wellness survey that is done every year to make sure that we are meeting the needs of our learners and their wellness. Some leadership and committee opportunities include our House Staff Council, which I think for the last few years has been, I think it's been 3 years, led by an IM resident, which makes me so proud. We have a Women in Medicine group on campus. We also have multiple interest groups within our program, including cardiology, pulmonary critical care, hospitalist track, and primary care. All of these are pretty robust and meet at least quarterly. As always, if you don't see something on this list that you would want to have as an interest group here, we can add it, and we have the support to do that. There are also lots of hospital committees across campus. Probably the biggest ones are our GE committees, DEI, and of course, patient safety and quality improvement committees. Some fun extras. So I know we offer competitive salary, great benefits, including parental leave. We have parking that's free, close, and secure. We offer free food 24/7 through all of our physician lounges to all residents on campus. So whether you're on call or not, you can grab soup, sandwich, salad, snacks, drinks, etc. from our physician lounges. And new this year, we have meal plans available. These were just implemented in the last few weeks, and I'm so excited that we are able to offer this in addition to all of the free food through the physician lounges that we have. The meal plans are provided through a card that each resident gets for the year, and funds are uploaded twice during the academic year. I am really excited to share too that the meal plan cards work at our on-campus Starbucks. So you can buy Starbucks on the program throughout the course of your year, whether you're on nights or something else. Again, we are well supported by our GME committee here on campus, and I'm excited that we are a hospital that is growing our GME, adding programs, adding capital, adding funds, and putting time and effort into these programs across the nation, but it's certainly on campus. For more information, I urge you to check out our website if you haven't already. Our program coordinators and leadership really do an excellent job of keeping that up to date. It has a ton of information on it about our leadership team, about our rotations, etc. So feel free to check that out. I'd also suggest that you find us on Instagram and follow us if that is something that you'd like to do. Especially over interview season, we offer things like day in the life of reels, so you can see sort of in real time what real residents are experiencing on campus. Can't wait to talk with you more later this interview season. I'll talk to you soon.